Friends, today we are talking about prediabetes, a silent but extremely dangerous condition. Prediabetes means your blood sugar is higher than normal, but not high enough to be diagnosed as type 2 diabetes. According to the Centers for Disease Control and Prevention, CDC 2023, more than 96 million adults in the United States have prediabetes, and over 80% do not even know it. This is why prediabetes is called the hidden epidemic. Why it matters, here is the shocking truth. According to the American Diabetes Association, ADA, within just 5 years, up to 40% of people with prediabetes may progress to full-blown type 2 diabetes if nothing is done. That means heart disease, kidney failure, blindness, neuropathy, amputations. This is not about numbers. This is about real lives. But here is the good news. Prediabetes is reversible. With the right lifestyle, nutritional strategies, and medical guidance, you can turn back the clock and restore your health. How is prediabetes diagnosed? According to the World Health Organization, WHO, and the ADA, fasting glucose 100, 125 mg/dL, 5.6, 6.9 mmol/L, oral glucose tolerance test 2H, 140, 199 mg/dL, 7.8, 11.0 mmol/L, hemoglobin A1C 5.7, 6.4%. If your results are in this range, you are at the prediabetes stage. This is the red flag. Symptoms, why you might not notice. Most patients do not feel sick, but small warning signs include increased thirst, frequent urination, fatigue, gaining belly fat, slow wound healing. Even without symptoms, damage to blood vessels and nerves may already be happening. Causes and risk factors. According to Mayo Clinic 2024, the main risk factors are family history of diabetes, overweight and obesity, sedentary lifestyle, high blood pressure and cholesterol, polycystic ovary syndrome for women, sleep disorders such as sleep apnea. But now we add another key factor, nutrient deficiencies. Studies confirm that low levels of vitamin D, magnesium, and testosterone deficiency in men significantly increase insulin resistance and risk of prediabetes progression. The core of reversal, lifestyle changes, nutrition, cut out sugary drinks. Even one soda per day increases diabetes risk by 26%. BMJ 2015. Avoid white bread, rice, and potatoes. They cause rapid spikes in blood glucose. Replace with high-fiber vegetables, legumes, nuts, and proteins. Example, eating 30 grams of nuts per day improves insulin sensitivity. Diabetes Care 2019. Physical activity. At least 150 minutes of moderate exercise weekly, walking, cycling, swimming. According to Diabetes Prevention Program, DPP, NIH, lifestyle changes reduce diabetes risk by 58%, twice as effective as metformin. Morning and evening walks help stabilize sugar even without medication. Weight loss. Losing just 5 to 7% of body weight significantly reduces the risk of type 2 diabetes progression, CDC 2023. Belly fat is the most dangerous. It drives insulin resistance. The forgotten piece, correcting deficiencies, your experience. Now let us add the fourth layer that most bloggers never talk about, but which is absolutely crucial, correcting nutrient and hormone deficiencies. Vitamin D, a meta-analysis in the Journal of Clinical Endocrinology and Metabolism 2019 showed that people with low vitamin D levels have 40% higher risk of progressing to type 2 diabetes. Supplementation improves insulin sensitivity and beta cell function. Practical advice, check your vitamin D level. Aim for 30-50 ning ml. Supplement if needed. Omega-3 fatty acids. According to a 2018 review in Nutrients, omega-3s reduce inflammation, improve lipid profile, and help decrease liver fat in people with insulin resistance. Eat fatty fish 2 to 3 times per week or take high-quality fish oil. Magnesium. Low magnesium increases insulin resistance. A 2013 meta-analysis in Diabetes Care confirmed magnesium supplementation reduces risk of type 2 diabetes by 15 to 23%. Green leafy vegetables, nuts, seeds, or supplements. Testosterone in men. According to Endocrine Reviews 2021, men with low testosterone have double the risk of developing type 2 diabetes. Testosterone replacement therapy improves body composition, reduces visceral fat, and increases insulin sensitivity. If you are a man with prediabetes, check your testosterone. Iron and ferritin. Both iron deficiency and iron overload worsen insulin resistance. Check ferritin levels, treat deficiency with iron, but avoid overload. Preventing complications. If ignored, prediabetes damages small and large blood vessels, retinopathy, blindness, nephropathy, kidney failure, neuropathy, amputations, cardiovascular disease, heart attacks, strokes. That is why taking action now is not about sugar only. It is about preventing lifelong suffering. Practical step-by-step plan: test fasting glucose, A1C, vitamin D, magnesium, testosterone, and ferritin. Eliminate sugary drinks and refined carbs. Eat high fiber, high protein, low carb meals. Walk 60 minutes twice daily after meals. Lose 5 to 10% of body weight. Correct deficiencies: vitamin D, omega-3, magnesium, testosterone, iron. Sleep 7 to 8 hours. Untreated sleep apnea worsens insulin resistance. Monitor progress every 3 months. Conclusion. Friends, prediabetes is not a death sentence. It is a warning sign, a second chance to take control. If you apply lifestyle changes, correct deficiencies, and follow medical advice, you can reverse prediabetes and protect yourself from diabetes and its complications. Question for you: which step from this plan are you ready to start today? Write in the comments, and in the next video, I will show you the most powerful foods that lower blood sugar naturally. Sources: authoritative only, CDC, Prediabetes Facts 2023, Mayo Clinic, Prediabetes Diagnosis and Treatment 2024, Cleveland Clinic, Prediabetes Overview 2023, ADA Standards of Medical Care in Diabetes 2024, the Journal of Clinical Endocrinology and Metabolism 2019, Vitamin D and Diabetes Risk Nutrients 2018, Omega-3 and Insulin Resistance Diabetes Care 2013, Magnesium Intake and Type 2 Diabetes Risk Endocrine Reviews 2021, Testosterone and Diabetes Risk.